Good afternoon, dear Facebook audience, ladies and gentlemen. My name is Nigar Baimova. I work for the British Council and I'm moderator of today's live talk on combating bias and stigma related to COVID-19. I'm joined by distinguished guests today and it's my honor to introduce them to you. Hande Harmanchi, World Health Organization representative in Azerbaijan and head of country office. Sabina Idrisova, QA and internal audit manager in MediClub, and Saida Rzaeva, corporate services manager, British Embassy. We were supposed to have one more speaker, Oruç Dursunzadeh, who contracted COVID and has kindly agreed to speak to us about his experience on this topic, but unfortunately he was taken to the hospital and couldn't join us today, but we wish him all the best and soon recovery and hope to see him at our next sessions. I welcome all our speakers and thank you very much for accepting our invitation to come and talk to us today. And I encourage our Facebook audience to be active and ask questions. And as a moderator, I'll do my best to address them with our speakers. You've probably seen from our posts in social media that this week we celebrate our Diversity Week in the British Council. And equality, diversity, and inclusion are at heart of all our values because we believe it's important to recognize and own the diversity which is surrounding us. And by celebrating diversities and differences, similarities, we believe that we help people to get a better understanding of each other. This year 2020 will, without any doubts, go down in history as a year when the world was ravaged by coronavirus called Covid-19. And as we've seen in the cases in Azerbaijan, the infection rate, the cases, they increase every day. And it's understandable that there is confusion, anxiety, and fear among the public. And unfortunately, these factors are also fueling some harmful stereotypes. And if we look at the history, we can see that such diseases, they tend to provoke xenophobia and bias. And we've seen that in the case of MERS or Ebola disease, and now with COVID. And we've seen the cases in Baku among our surroundings that stigma can lead people to hide symptoms of illness just to avoid discrimination. And they may not, for example, seek health care when they need it, or they may want to isolate themselves, which comes with its own health risk. And sometimes this stigma can lead people to such things like, the disease can be less harmful and dangerous than stigma and discrimination which surround it. And it's important that we unite our efforts and prevent such cases. And I know World Health Organization has done a lot of work in this area. And I would like to invite Hande Hanım to share with us her views on why it's important that stigma related to COVID-19 needs to be prevented and what work have you done in Azerbaijan. The floor is yours, Hande Hanım.
Thank you, Nigar, and thank you, everybody, for inviting me, and I thank the British Council for this. I think it's really important that there is a platform for people to be able to speak freely, and I wish really Oruç Bey was with us because we really need people to step up and talk about their experiences for to prevent or overcome the stigma and discrimination also. Public health emergencies are stressful for everybody. And the current pandemic has also provoked the social stigma and discriminatory behaviors against certain people. Like you will remember in the beginning of the pandemic, around the globe, in some countries, people who looked Asian were, really they were sometimes they faced, physical violence even in some streets. But we know that most discriminatory behavior really depend on, as you also were mentioning, depend on three issues. First of all, in terms of the COVID pandemic, this is a new disease. We still don't know a lot of things. We know more than when, for instance, March, but we still don't know a lot. So not knowing a lot about the disease, and that causes us to fear the unknown. So we always fear the unknown, and when we are fearful, it's easier to associate this fear with others, with not self but somebody else. It's because of them, him, her. So these are the three things that come into play when we talk about, fear and public health emergencies such as this COVID. But I mean, people know about this. That's why countries are putting a lot of effort on communicating the correct information. And as you know, WHO, as you said, has been fighting with this global infodemic. And we are putting as much effort in this managing this infodemic as we are putting in technical areas. Because if you cannot manage the myths, the false information, it's really very, very difficult for people to be able to achieve something. Like I was thinking about this and this talk, and I remembered something that Mark Twain said. He said apparently a lie can travel halfway around the world while the truth is putting its shoes. So because lies, gossip, conspiracy theories, they are more exciting. They attract people from many different places, so they actually spread much, much faster. So it's important to fight this nonetheless, because if we want to stop this pandemic, we want people to be able to come and seek healthcare, right? We don't want them to hide somewhere and continue transmitting the virus to others. We want them to get better as soon as possible and stop the transmission to other people. And we also want them to encourage healthy behaviors, following up with the healthy behaviors, etc. So that's, as you also rightly mentioned, these are very important issues if we want to manage this pandemic. And what can we do? What can we do? It's first of all, it has to be a country, regional, global policy. We have to recognize that some stigma and discrimination might come with public health emergencies such as this pandemic. And then we have to really pay attention to how we refer to it. I think words really do matter. If you remember, some people tried, or they associated this pandemic and they tried calling it other names like Chinese flu or Wuhan disease or something like that. I think this is very important because it could start anywhere. This disease could have started anywhere. And so it doesn't really matter where it started, but what matters is how we are going to, as a global community, handle this. So we have to really pay attention not to associate the disease and the psychology that it brings with a certain group of people, a geography, country, etc. I think what we all can do as citizens is also speak accurately about the pandemic and don't share misinformation. Do not share further the things that you are not 100% sure about. That's how these conspiracy theories really spread. And the other thing, this is actually my motto everywhere, in life, try to focus on the positives. I know we are missing a lot, but we also have a lot of, very effective measures that all the countries are using. And as they are using them, we see the numbers are coming down. So focus on the positives and spread the news of how we can manage this. Stick to the facts, stick to the evidence, and don't use exaggerated language like this is a calamity, it's the end of the world, this is a conspiracy, everybody's trying to get to us, etc. This is really not very helpful. And we should all remember that facts, science, and evidence will stop this pandemic, not myths, conspiracy theories, or stereotyping. Thank you.
Thank you, Hande Hanım. Definitely, we've heard a lot of conspiracy theories since this started, and that's why it's important that we speak openly about it, and people feel comfortable to come forward when they feel the symptoms of the disease, and don't feel that they will be discriminated or there will be biased against them, because it happened. It happened around the world. It happened in Azerbaijan, and I know within my surrounding, people chose to stay at home and not go to medical practitioners. And Sabine Hanum, you work in MediClub and you are in medical area. What do you think are the consequences if people hide illness or symptoms just to avoid discrimination? Because from media reports, this can lead to harassment, bullying, and so what do you think are the consequences from your experience?
Thank you for the opportunity to take this in this talk online, and I'm very glad to see everybody here. And thank you for the British Council also for the possibility. And I would like to say that you can imagine that just saying that somebody COVID positive, it's really can make one worry about what's happened, why it's happened with me, and what I was to care, was I not taking proper precautions. And of course we are starting think about how I can now to treat these diseases. And yes, really the stigma is so high that some people actually trying hiding their diagnosis, and or someone of patients starting to deny that no, it's wrong, it's not it's wrong results of PCR. I am not believe on that. And it's also possible if they have asymptomatic form or mild form, when you are really feeling yourself very good, and you just have these test results as a positive, that's all. And it's very difficult really to explain patients that you should have isolation for 14 days. And they a lot of them not accept this 14 days quarantine, and they insist that it's wrong and goes to another laboratory to take another testing and etc. But I would like to say that PCR test is very specific, and but has a low sensitivity. It means about 65 or 95%. What means that if patient infected, but the test can be negative. So we should remember, if we receive negative PCR but we have symptoms, it's not means that you are not COVID-19 have. So we should be isolated for 14 days, certainly. And also, when people hear about COVID positive results, of course, they are starting thinking about their family, their loved ones, that they can infect them also. And they started asking about how I can prevent this spread of this infection. And it's good if they reply to the doctor. But I really believe that our responsible media reports should, in phases prevention, practice symptoms to look for, and when to seek care. The wrong information and started the wrong treatment in the early phase of these diseases, for example, viral replication phase, it can lead increase viral replication and disease severity. You should remember that about 14% of COVID-19 is has a asymptomatic form or mild symptoms. So if you are a healthy individual without any risk, you can treat this disease, and after 14 days you have no any symptoms, and you can return to the society. But yes, of course, we have severe results when we have risk factors, and when people started to treatment ourselves. when hearing from take information from the non-reliable source from internet and etc. They are starting to take antibiotics. They are starting to take some other drugs without consultation with doctors, and unfortunately, this lead to the unpleasant results, and they have some problems then with the health, and then when it's not when they have some problems with the health, they started to apply to doctors and ask about health. And really, when we started to consult such kind of patients, it's very difficult to correct these mistakes in the treatments. So it's very good if you understand that COVID positive is not stigma, really not a stigma. It can happen with everybody from us, and it's not such danger disease. We have a lot of another dangerous disease like oncology, for example. Yes, and COVID-19, it's a disease when we can treat if we take all measures. First of all, if we we should to take these prophylactic measures like preventive measures like social distance, taking a face mask and washing hands and etc. But if we have positive results, we should apply to our doctors to have a really initial treatment in time. And I believe that in that case, and also it's very important to track contacts. I also would like to say that we should have information with whom we have contact, and each persons should also take measures for 14 quarantine and not contact with another persons, so we can not to spread this infection more. Unfortunately, people don't do like that.
Yes, yes, but that's why it's important, Sabina Hanum, to have this informative session so people don't feel like they will be discriminated, or there's, as you said, like it's not that serious, that like dangerous disease.
It's serious disease, but if you apply in time, you can be healthy in short time.
Exactly,
without any problem in your health.
Exactly, because I looked at the statistics that COVID-19 causes severe illness in only about 20% of those infected, critical illness and death in up to 5%. In most of the cases,
exactly.
People, they recover. And so it's very important and reassuring for the public to hear experience of people who passed this disease, who contracted and recovered, so that this misinformation, this conspiracy theories, this, as you mentioned, like
it's really emotionally draining, when you're starting to think why it's happened with me. And it's also financial draining for the people who should stay for 14 days in isolation and can help for his family, for example. If they are working, only they are working in their family, we also should think about. But it's not a reason to hide this diagnosis. So it's possible to treat. It should be informed about everything, but he should have proper information, from the accurate information from the reliable source.
Yes, thank you for sharing this.
You're welcome.
We have as our guest Saida Rzayeva. Saida Hanum works in the British Embassy in Baku, and I know that you had one of your colleagues, Saida Hanum, who contracted COVID-19, and I know the whole process of addressing this went smoothly. So can you share your experience of how this was handled at your workplace? Please, floor is yours. I think you're on mute.
And thank you for this. Thank you for this excellent No, I'm not. Do you not hear me? Hello?
We can hear you now. Yes.
Nigar, do you not hear me?
I hear you.
You can hear. Okay, thank you. Yes, I'm saying thank you very much for this initiative. First of all, excellent topic to discuss with wider public. And thanks for the question. Actually, we have a few by now, a few positive tests in the embassy, and we are in constant communication with staff. All stuff about it. First of all, we issued the staying safe guidance, which is rules for all staff to follow in the embassy. We talk about it at all staff meetings and post-executive board meetings as well. Heads of sections are also discussing it within their teams. But unfortunately, despite these measures, some staff seemed to either misinterpret or got confused with the rules. And for example, we had one person who came into the office while his wife had symptoms at home, and even passed the test, although the test result was not known at that stage. So the outcome was that she got positive, he got positive, and although despite the fact that we had immediately sent him home to self-isolate, we had to do the same for several other colleagues, because those who had been in close contact with him that morning in the office. And it might have happened because a staff member thought that his commitment and dedication could have been questioned by the office. And therefore, I had a session with local staff in Azerbaijani language. It was open to all staff and all local staff, actually. But primarily, I was aiming the lower grades, those who are non-fluent English speakers. And so it was basically to reinforce the key messages from our staying safe guidance. And mainly it was that if someone has any cold, flu, COVID symptoms, either by staff themselves or by even someone at home in their household, that they should stay home. They should not come into the office. That they should speak openly to their line manager and be transparent about how they feel, how their household members feel, who they met over a certain period, so that we could start the contact tracing process. And at that session, I also went through the flow charts on like what to do if staff feel unwell, or if they've been in close contact with someone who was either unwell or having had a positive test, so that everyone was clear on the steps to take. But the very key message there was that it is safe to talk about it, to be open, that there is and will be no blame and shame, no penalty for missing the work, no one will lose their jobs or salaries. And on the contrary, that staff will be more respected if they are open and honest about things, and that there is no expectation from the office that people, if they are unwell, they should come into the office. And I must say here that from the very first days of COVID infection, the Foreign Office, which is the UK's Ministry of Foreign Affairs, announced its support to all staff, both the UK and UK-based and local staff overseas, and declared that there will be no impact on staff's pay or jobs if they cannot perform their duties, either due to being sick or for their inability to work from home. And moreover, HR issued various like new types of sick leave, COVID-related sick leave, and special paid leave for those who cannot work from home. And that includes such categories, job categories as drivers, the security guards, cleaners, gardeners, etc. And the special paid leave, so from standard 10 days, it was exceptionally agreed to 3 months and then extended to 6 months. So to conclude, like we continue to talk to people, to all staff about the issues, especially with every learning point we have in the office. So that's mainly about our experience, and just having representative from A group here from MediClub, Sabine Hanum, I would like to use this opportunity to thank our medical insurance provider, our group, for their engagement and support with our cases of our both sick staff and their dependents. It's very important to have such reliable partner in such challenging circumstances. So thank you very much for your engagement and support.
Thank you, Saida Hanum. It's very reassuring to hear the measures you've taken and the supportive environment you have created. I think it's very important for those who do contract COVID to know that there is support system in place, and thank you for sharing your experience with us. Hande Hanum, you mentioned a very interesting point to which I want to come back about this disease being associated with specific region and being called China virus, Asian virus, Wuhan virus, which is completely unacceptable. And as you rightly said, it could have come into surface in any region. And we've seen such cases of people being discriminated in UK, in US. Can you share your experience? Have you witnessed anything here? What can be done about this? How can we handle this? Please.
Thank you. Before that, may I just add something to Saida Hanum's words? I think what she talked about is actually very, very important, because nowadays we know that most of the new outbreaks of COVID-19, they happen in certain places like workplaces, in offices, places of worship, in funerals, in weddings, wherever people get together, and there is, they either spend a lot of time there in closed environments, or where they have a lot of emotions, where people, either sing or cry or chant or something like that, and there's a lot of secretions from the mouth. And if it's a closed space, then it's really a very, very good breeding ground for the new outbreak to happen from there. So these are the super spreading events that we frequently mention. So, and offices are like that too. So I know that as in Azerbaijan, there's been a lot of policies about reducing the number of people in the offices, etc. And I think that's a great thing. I think that's what should be done. And in addition to that, it's very important, though not maybe very easy, but it's very, very important for the employers to understand that, especially nowadays and maybe in the coming 3-4 months, when a person calls in sick, that person should be believed. So, a trusting relationship should be built around this, because if we want people to stay home when they are sick, we have to believe them. And it's very important for people, if they are feeling sick, to stay home. So this is something that's very important. Another thing about workplaces, the world has gone into these, they have been building around a lot of smart buildings, high rises where you cannot open the windows. I think, personally, I didn't like those buildings at all. And I'm hoping that, new buildings will now be a little bit shorter, where you can open windows with balconies at least. I think that's coming to be maybe a new norm from now on. And I would be very happy to hear about that. The 1918 flu pandemic, for instance, was tagged as the Spanish flu, okay? That killed around 50 million people in conservative estimates. And then we had in 2009 another pandemic with influenza, a new influenza virus, and it used to be called in the beginning swine flu. Now, in 2005, we had something called bird flu, okay? I'm giving examples of animals because I'll tell you why in a minute. What happened in 2005 and 6 during this bird flu epidemics, it didn't quite turn into a pandemic, but a lot of animals, a lot of chickens and geese and whatever, they were killed and culled. So a lot of industries went bankrupt because of this. Same thing started happening in 2009 with swine. You know, many people, they were attacking farmers who were growing swine, and they were killing animals, etc. So in terms of humans, that might not be quite the same thing. But if you put a label onto a group of people, an ethnicity, a nation, a country, and blaming them for something such as this pandemic, that I think will go to very, very dangerous places, first of all. I mean, of course, it's not right in moral terms, but it might also be very dangerous in terms of, you know, human relations, peace efforts, trade agreements, etc. So it's really a very, very difficult thing to manage if such a stigma is attached to a group of people. You know, we know that there is already some groups of people in every society who are labeled with being, I don't know, lazier, or, you know, poor, being, you know, thieves or whatnot. There's a lot of discrimination and stigma in every society. I'm sure there are in Azerbaijan also. So it's very important to not to fall into that trap while we are trying to deal with this disease, and really, as much as possible, to try to keep sane, cool, calm, a little bit detached. I know it's not possible if your loved ones are affected, but still, you know, let's fight the disease, not each other. That's why, you know, the president, when in March or April, I think the slogan was, what was it? Biz birlikte güçlü, right? That was the slogan for fighting the pandemic. So it actually called for solidarity, because we, unless, you know, if we are all healthy, then we can be free from this pandemic. You know, we cannot be healthy when somebody else in some other country, in some other city is sick with this disease. So we all have to be together to fight this disease. Thank you.
Thank you, Hande Hanım. It's very important to have compassion for each other and address this together. I know you have to go. I want to thank you on my behalf and behalf of the British Council for joining us today. Thank you for coming and sharing your views with us. We have really supportive comments I see from our Facebook audience, and it was very interesting to have you on our live talk, and we hope to see you again. Thank you very much.
I see that my mother is also watching.
Our best regards to your mother from here.
Thank you very much. Yes.
Salamlar buradan.
And she's at home. She's in the higher age group, risk group. So she's at home. And it's very, very difficult for the elderly. I mean, let me say a few words about that, because they are already very confined, usually, in their social interactions. And now this came, and it really put them under a lot of pressure. Now, my mother, they used to meet with friends 2-3 times a week and spend time together. Now they are not doing this. And I'm very happy, and I feel grateful, because my mother can join Facebook and watch things like that, and is interacting in the social media. And I think that's a very good thing. If there is one thing that, maybe one of the things that we can do during this pandemic to our elderly is maybe, giving them the opportunity to interact from the social media, because it changes. They can interact with people outside the country, with relatives that are living outside, etc. So thank you. With this, I would like to thank you all, and have a very good evening and rest of the show. Bye-bye.
Thank you, Hande Hanım. Bye-bye. Hande Hanım mentioned a very vulnerable group, elderly, and also I really like that she talked about opportunities, because my mother is 75 and she's a teacher. So when this all started, she learned how to use Zoom and now she has online classes using Zoom, which I think is great, that she's learned new skills. And so every problem is an opportunity. So as we've seen, also Hande Hanım mentioned elderly group, but Sabine Hanım, I know we heard these rumors that sometimes men and women take this disease recovery differently, that sometimes men it's more difficult, it's more passes more complicated way than in women. Can you say something about it?
Not only women, not women. I trying to explain. Yes, we have some biological, of course, we have some biological differences in the immune system between men and women. And as I know, in women organism, we have such hormone as estrogen, which is really help us to fight any infection. And especially this COVID-19, and really we have more strong immune systems than men in such point. And also we have high expression of coronavirus receptor angiotensin converting enzyme 2, and in men it's higher than in women. So also if we have now for 2 days some data from certain studies and surveys that shows us that data about this. I mean, it's more appears be higher this in men. It's about 51%, and it means that not only because of biological differences, but also I would like to mention that women have no so much smoking and drinking as a man, for example. And also women have a more responsible attitude towards COVID-19 than men. They are more likely to wash hands and stay at home, for example, than men. And that's why in such point of view, women are more resistible to the COVID-19 than men. I can suppose that's because of these factors.
Thank you.
Also age. I would like to say about age. Yes, of course, we have in the beginning of these diseases, especially in Italy, we can see that a lot of older patients have very negative results, and we have a lot of deaths among these age groups. But for today's, we have more and more information that younger patients have really bad results and negative results and have a more severe stage of this disease. And I think maybe because they had symptoms, they starting wrong treatment, they not apply treatment protocols, they not apply advices of doctors. That's why maybe they have negative results.
Thank you, Sabine Hanım. Saide Hanım, can you share with us your views on why it's important to address bias and stigma?
Thanks, Nigar. So in this context, I understand that stigma is associated with low or lack of knowledge about the disease, the assumptions and gossips which people make and spread, as well as obviously anxiety and fear of death. Overall, people have negative attitudes and beliefs which could lead to stereotyping and discrimination, especially to some particular, related to some particular persons, for example, those who have had COVID, although recovered. Stigma can hurt and undermine people's dignity, and this could lead to people being scared to be open about it, and or even preferring to hide some health issues or health condition details about themselves. And that in its own turn may bring to higher COVID numbers of COVID infection rates. So addressing COVID-related stigma is very important for populations' mental and physical health, as well as the well-being. And I believe that we all share the responsibility for good public health practice, whether it's maintaining social distance or wearing mask appropriately or washing hands regularly, everything all together, and that we should demonstrate the good behaviors that come to embracing and valuing diverse people and society and like different groups and communities. And there are some things, obviously, which possible actions that could be done in the workplaces, and that obviously includes continuous talk to people, open and safe talks with staff, putting up relevant posters and signs in the office, publishing key facts about the disease, and surely expressing no negative attitude or language. And there are a couple more things I wanted to mention about our embassy's practice. Firstly, I know that any health issue or medical condition is a sensitive matter, and so is normally treated in confidence to maintain the privacy of that person. Having said that, when we started to have first cases of staff self-isolating, whether because they were unwell themselves or because they had been in contact with somebody who had tested positive, and many staff members expressed their concerns over that confidentiality, and they wish that the details were shared with all staff so that they would know if they'd been in close contact with those or not, as relevant people may not remember everyone because they're like everyone that they've been in contact with, because they're quite stressed and worried, obviously, themselves at this moment. And therefore, given that it's not kind of usual personal matter as with any other disease or health issue, as this one may affect others, we now ask relevant colleagues for their permission to share the details with all staff, and do that after. So far, no one rejected, and people find it quite reassuring. And additionally, I believe personally that it helps to reduce anxiety and fear. And the second thing is that we are now doing some virtual get well cards for colleagues who are COVID positive, and all staff enter their supportive and encouraging messages into those virtual cards, and then we send them to the relevant people. And I think acting so in normal cases, or when staff are being sick for a longish period, also helps people's mood and tunes them for recovery. So I think it's another kind of extra care, especially when we are so distant from each other. Thank you.
Thank you. It's very nice to hear such supportive measures are taking place at the embassy, and I'm sure a lot of people who watch our live show will take good examples and replicate it in their organization. Sabina Khanum, you are in the you are practicing medicine.
Yes.
You are working in MediClub. I just wanted to learn whether you collaborate with other medical institutions in addressing this issue. Do you have any virtual meetings, or how do you share experience with each other? Because as Hande Hanum mentioned, to combat this, we need a unified effort, and we need to put our strengths together. And as our president said, we have to be strong. So it would be interesting to hear your views on what measures are, whether there are any meetings or any experience exchange.
Yes, thank you for the question. We are working, MediClub is working with different insurance companies, as you know, And of course, with the experts of this insurance company, we are talking about every case, and have discussed in any individual case which we are doing. We are making consultation at home by distance consultation, or we are trying to hospitalize such kind of patient because of his condition, and taking into account the risk factors, the age, and possible diseases which he has. Such as that during COVID-19 has diabetes mellitus or high blood pressure or obesity is a risk factor which can influence on the treatment and on the severity of disease. So, taking into account such kind of cases, we also have our WhatsApp group in our among our doctors, and we describe every case, and we describe new guidelines by COVID-19. Every week, if we have some news, we put these guidelines in our group and shared this information. And if we have a really interesting case, we discuss it during our morning meetings. But of course, in pandemic, during pandemic, we are not gathered together. I mean, physically, but we can discuss this like now, interactive and online. We are trying to sharing all information which we have, all news which we have, and all possible results of the treatment. For example, some drugs can help, some drugs can adverse effects, and we discuss why we should not prescribe such drugs, for example. And it's really help to us, to the doctors, to share such kind of information. It's medical information, and it's very useful for us and in our practice, of course. And also we are looking for we are watching for webinars, which are a lot. Thank you for the internet and possibility to have such online education and webinars, which are a lot. And thank you for the World Society, because they open all sites which were not free, but now it's free. It's like up to date and etc. So we can chance to read about all news, all guidelines, and we use also WHO organization site, also CDC site, and etc. It's a lot of, and everybody. I can say for MediClub, every doctor in MediClub every day trying to read, to see, to learn something, and of course share it with other doctors. So we on front line and should be educated well, I think.
I would like to take opportunity to thank all doctors who worked very hard to in these difficult days. We're very grateful for all their efforts, and thank you and your colleagues in MediClub for helping us to stay healthy and recover. I read in BBC today that in UK they got approval to try vaccine as of next week, and it's very encouraging news. The news was released just like an hour before our session started, so it means it's there. The vaccine is there, and it's UK. I think ordered 40 million. 40 million vaccines to test, and of course priority will be given for those at the risk factor. How about in Azerbaijan, Sabina Hanum? Do you know what are the developments and next steps? Because this question is always asked, and our audience is also interested to know whether there are any updates on this area.
What do you mean about vaccine? You mean, or about treatment guidelines?
like a vaccine. Have you discussed this with your within your community? Because a lot of anxious to learn when there will be more protection and vaccine, because I think several countries produced vaccine nowadays.
Yes, it will be really very good, but we still not know very good these diseases, I can say, and we know that a lot of patients, a lot of patients after 14 days trying to give a test on antibody, and to learn, that it's we checking for two antibodies, immunoglobulin E, M, and G. M is show us that it's still active active phase of disease, and M is show us that its immune system is working and you have already resistant to the virus. And it's really very interesting that we have no exact confirmed facts that we have reliable immune system reply during which duration. It's different information, different source show different information about from 4 months to 6 months. You can be not infected by this virus, but we also meet such kind of cases when after 2 months we have again COVID-19. It means that maybe individual has weak immune answer on this virus. Maybe he has, it's especially when he has asymptomatic form. But when you have a mild form of this disease, it's certainly you have antibodies, and you can be safe for 4-6 months at least. About vaccine, it's a experimental phase. We couldn't say in any I don't know. We don't say that it can help. We just to see when we are started to do this vaccine. But in any case, I believe that it should be help, because we have, for example, vaccine against flu, and it's really work. Every year I see patients who are coming to the MediClub, for example, and do this vaccine, and saying us to really help. This vaccine really help. We have patients, especially older patients, especially patients we have which have some problems with the health, cardiovascular diseases. They really needed to do this vaccination, because flu can cause very negative effect on the cardiovascular system, and I think that if this vaccination against COVID-19 will be such effective like vaccination against flu, maybe in the next year we have we have really good results in our fight with COVID-19, and reduce these cases of this disease among people.
Thank you, Sabina Khanum. With vaccine or without vaccine, I think COVID-19 is going to be part of our
Exactly.
life to come, and because it does change the way we practice medicine, interact with one another, and live our lives. And through all of this, we need to remember that we need to have compassion for one another. We need just to take scientifically grounded approach, and of course, hope for better times ahead of us. And with this, I would like to thank all our speakers today, and stay healthy, and see you very soon. Bye.
Thank you. Thank you very much. Thank you.
Thank you. Thank you. Bye.
Bye.